if I take just a 1 week period from the 8th of March up to the 14th of March, on the 8th of March our All India daily new cases, which is the parameter which is the most tracked really, were close to around 15,300 odd. By the 14th of March, you've gone up to 26,500 odd new cases. Among these, Maharashtra continues to lead with 58% of the cases, but this proportion of how many cases are in Maharashtra in percentage terms is dropping, which shows that cases also rising in other states. Kerala, Punjab, Tamil Nadu, Karnataka are also seeing spikes. We're also seeing an increase in restrictions. Now, to put this in perspective and understand what we're truly headed for. Is this a second wave? Are we seeing localized flare-ups? I have with me Dr. Randeep Guleria, the director of AIIMS. Dr. Guleria, thank you so much for speaking with us here at ET Now. And let me just begin by asking you that basic point. What exactly are we seeing right now? Are we seeing the beginning of a second wave?
Yes, if you look at the number of cases, we're seeing a rise in number of the cases, which is steady. And as you rightly said, it is happening in regions beyond what was initially happening in Maharashtra and Kerala. And therefore, this could be a beginning of the second wave or a new wave, if I may put it that way. The challenge that we have is how can we prevent this from really becoming a big spike, and how can we quickly bring it down so that it doesn't become a huge wave. But as of now, yes, there is a tendency to suggest that we are seeing a surge in the number of cases, which is localized right now, but there is data suggesting that it is spreading to other parts of the country too.
What is the cause of this, Dr. Guleria? Is there any way of knowing? I mean, one theory is that people just were careless, etc. But then people have not altered their behavior in any big way in the last month or so from when we've seen the spike in cases. Could you put this down to mutations that may have entered the country or new variants of the COVID-19?
So there could be multiple causes, and the causes that really are very evident. One, of course, is a gradual decline in what we would call COVID appropriate behavior. When the number of cases really came down about a few weeks ago, a lot of people started saying that now COVID is over from India and COVID is not going to come back in India. And COVID appropriate behavior really crashed and became very, very little. People actually even started having parties and stopped wearing masks. Physical distancing was not maintained. Many people even went on holidays without wearing a mask and without having any COVID appropriate behavior. The virus had not gone away anywhere. The virus was still there in the community, and one gave the opportunity for the virus to spread. And we already know that we had data from ICMR, which clearly showed that we don't have good amount of immunity. Only 20 to 25% of immunity was there among citizens in our country. And that means that around 75% of us were still vulnerable to getting the infection. So if we were not taking proper precautions, there would be people who would get the infection, especially when we started having huge parties and crowds, which could become super spreading events. Secondly, we do know that variants happen, and variants have been seen over the last 1 year. There have been variants across the globe from Brazil, South Africa, UK, and Europe. And I'm sure there are variants in India itself. So there are chances that variants will become more infectious. They will have the virus is in its way trying to survive, and therefore will try and spread more rapidly if it can. And that is why, if we keep that in mind, then COVID appropriate behavior and aggressive vaccine strategy are the two tools that we need to use to really counter the variant which may have been emerging, or the increasing number of cases that are happening because of decrease in COVID appropriate behavior.
In the context of COVID appropriate behavior, now a lot of local administrations, several states have responded in different ways when they see a spike in cases. Some have put in place night curfews and varying degrees of restrictions depending on the area. In your view, do you think this helps? Do you think we need to move towards a situation of greater restrictions at this point?
So what we need to do is we need to go back to what we were doing a few months ago, and which was the basic thing that we're doing. That was basically identify areas where we're seeing increased number of cases, very aggressive strategy of testing, tracking, isolation. So if we have increased number of cases occurring from a particular area, we need to really develop micro containment zones in that area, make sure that people from that area are tested, they're isolated, and if they're positive, they're put in isolation or they're quarantined if they have a history of close contact. And we thereby don't allow those cases to spread to other parts and cause increase in number of cases. So the testing, tracking, isolating strategy needs to be more aggressively followed. And at the same time, containment zones need to be developed wherever we are seeing a cluster of cases so that we are not allowing this to spread. Having a panic or a knee jerk reaction may not help. At the same time, now with vaccination being available, we need to also aggressively step up vaccination in these areas.
Yeah, I was coming to that as a follow-up question, Dr. Guleria. Vaccination. Now, India has vaccinated close to 3 crore people, but we're still lagging behind, say, the US, China, European Union, etc. Is it time now to throw it open to all willing adults who want to get vaccinated? That's going to happen from the 1st of May in the United States. We have no shortages of vaccine is what has been told. So let me put this clearly in two parts. Do we A, need to allow anyone who can and is willing, an adult, to get vaccinated, not have these restrictions of above 45 with comorbidities and above 60? And B, do we quickly need to give authorization to new vaccine candidates so that we have no dearth of supply at all?
So coming to the first question, I think we need to understand what is our aim for vaccination. The first aim for vaccination is to prevent deaths, to make sure that those who are vulnerable are vaccinated as early as possible so that we are able to prevent people dying from COVID-19. And we know that this is the elderly group and those who have comorbidities. And therefore, we need to make sure that we are able to vaccinate them as early as possible. I do agree that there could be areas where we are missing out on these people because of the fact that they may not be tech savvy or may not be able to reach the vaccination sites. And therefore, whether it be urban India or rural India, strategies need to be developed so that we can reach out to these people and get them vaccinated so that they are protected. Once we're able to do that, and we are confident that we have sufficient doses. Remember, this is a vaccine for which you need 2 doses. And therefore, if we are confident that we have sufficient doses for vaccinating people twice, and if we're looking at the first phase, which is 30 crore, we need 60 crore doses, which is 600 million doses. If we are confident that we would be able to have that many doses, we need to then start opening it up to the other group. Or we need to look at a strategy where we say that, okay, once we have reached a tipping point where feel that now we are confident that we have covered a significant amount of those with comorbidities or the elderly, we now allow it to be open up the vaccination from everyone. This is something that we need to really work on. But I think the first priority should be to save lives and therefore vaccinate the high risk group as early as possible. I missed your. I'll answer the second
Do we
point
have the
also.
time for that? Yes,
I'll,
I
I'll
will
just answer
reiterate
your
it, but
second
just a
point
quick
as far as.
follow up. Do we have the time for that? We're at 3. Yes, sir. Please go ahead.
So coming regarding the time for that, yes, we need to do it as early as possible. Time is the essence right now because of the fact that we are seeing an increasing number of cases, and the more people we vaccinate, the better we would be in terms of decreasing the number of cases. But like I said, that we need to vaccinate those who are in the high risk group first, and we need to work on a strategy that we reach out to them and do it as early as possible. If we have, if we can at the same time open it up to others, that would be an ideal situation. But it would be very wrong if we were to vaccinate the young who had a less chance of dying because of COVID-19 and miss out on those who really needed to be vaccinated, and we had an increasing number of deaths because we were not able to vaccinate those who had a higher chance of dying because of COVID-19. Regarding the new vaccines, yes, we need to get as many vaccines as we can. That will help increasing the number of doses that are available in the country, and that needs to be done by the regulatory authorities. But that can only be done once we are safe, comfortable that these vaccines are safe and would be effective and safe in the Indian population. I'm sure that is being looked at. We already have a number of vaccines which are in trials, and I'm aware that Dr. Reddy's laboratory, which is partnered with the Gamaleya Institute for the Sputnik 5 vaccine, is already applied for emergency use authorization. Hopefully, they will also be able to bring the vaccine to the market, and we will have more and more vaccines coming in the next few weeks. So I hope that that will increase the load and allow us to open it up much more.
Dr. Guleria, I must ask you about what is happening globally with the AstraZeneca Oxford vaccine, where there are concerns over reports of clotting. There are reports that some countries are reviewing the use of this. And I'm asking this because our most populous vaccine is based on the same formula, that is Covishield. Are we looking at any kind of these reports in India? What is the context here?
So there have been reports of people who've had complications like clotting, both from in Austria and the Norwegian country, especially Denmark, where they found that some people after vaccination, a few days after vaccination, had clots, and two people actually died subsequently, and one had what we call pulmonary embolism. But we must understand that we have to show a cause and effect relationship, because the people who are being vaccinated are those who are at high risk, the elderly or those with comorbidities. They on their own could also develop clotting because of the underlying diseases that they have. And therefore, it's important that we are able to tease that out, that was this coincidental or was it related to the vaccine. If you look at the entire data, this vaccine has been used not only in the European Union, but to a large extent in many other countries, including the UK and in India. And there have been no red flags either during the trial time or even subsequently of increased clotting, which has been reported which has been observed in Denmark and the other countries. So therefore, the vaccine there has been put on hold to really look at the data and be sure that we are not missing out on a rare side effects. But as of now, it seems unlikely because millions of people have been vaccinated using the AstraZeneca vaccine, and there's really no data from other sites to suggest increased clotting.
Just a last take from you, Dr. Guleria, as we're approaching very soon 1 year really since the lockdown in March 2020, and so many lessons have been learned, but among them, do you think that we have enough of information, enough of a handle on what is going on with COVID-19? We now see a new wave coming, some reports that it might be less virulent, but just not enough information, even a year later, on whether all vaccines work, to what extent vaccines work, and how long this virus will be around. Do you feel you have any clarity after this time period?
So we've come a long way since the virus was identified way back in 2019 December, and then cases started increasing, and we had a WHO declared it a pandemic, and then we had the lockdown in India. We've learned a lot as far as the virus is concerned. That has helped us in making the vaccine, uh, making a better treatment strategy, which has now decreased the mortality, unlike what we had in March, April, and May. But there's still a lot to learn because this virus keeps mutating, it keeps changing, and as it changes, it throws up new challenges to us. So, therefore, it's a constant learning. But there are lessons which we've learned in the past, and I think we need to really build on those lessons, both when it comes to preventive measures in terms of vaccination or what we can do going ahead. If we are able to build on what we've learned, I think we could come out from this pandemic much more earlier and in a better situation. But if we don't do that and keep making the same mistakes, then we are in for a long haul. And that is why I keep emphasizing that what we did a year ago in terms of aggressive and good COVID appropriate behavior, testing, tracking, isolation, and following all the norms is something that we need to do now. I do also understand that there is a lot of COVID fatigue because 1 year is a very long time, but we just need to hang on there for some more time, and it will help us to come out of this situation.
You know, I know that all experts I speak to absolutely detest this question. But yet, Dr. Guleria, I will take the risk of asking you, when do you think this will be behind us? Now that we have the vaccines, we have some amount of data and we've started vaccinating, Can we see the end of the tunnel? Is there a timeline in mind?
So when we look at this, there are two things that we can say. One is, when will we be in a situation where we could say that we would be near normal with COVID appropriate behavior and other things, but life would be really back to normal. And second would be, when can we say that the pandemic will really truly be over? I think for the first question, when we can say things will be back to normal, I would say that it's probably by this the last quarter of this year, when we will have vaccinated a significant number of people globally and in our country, that we could say that there is sufficient degree of immunity that we could life will start becoming as normal as possible in terms of travel, in terms of other things. But the virus is not going to go away there, and it'll take a longer time, maybe more than a year or two, to really come out of the pandemic totally, because of the fact that the virus will continue to change and we will have to evolve strategies to really come out of the pandemic and get the virus into what we call an endemic stage, where we'll continue to have cases to some extent, but not like what we're seeing from the pandemic point of view.
All right. Thank you so much, Dr. Guleria, for speaking with us. The AIIMS director there, sharing insights on what he says is, in all probability, a new wave that we're seeing across the country. Cases have been spiking. COVID appropriate behavior will have to be underlined once again. And it's also very important to speed up the rate of vaccination. Thank you so much, Dr. Guleria, for speaking with us today.